So now we have fairly aggressively progressing and quite usable general intelligence. That is your ChatGPT, you go ask them questions, and the Gemini, you ask them to write your code. But that's a general intelligence, right? So now in the healthcare, there is the last piece, which is very specific for that domain, for that population, for that specific program. So in a way that in order for these chatbots or this technology or Doro technology and be very, very useful and safe to that particular use case in the population, you need to go and work very closely with them to bridge that last mile. Then the general intelligence and versus the very specific clinical intelligence can actually marry and make this technology very useful.
We're building chatbots and agents for healthcare system, and the problem that we're solving is continuity of care. Because right now, healthcare system has a lot of challenges with spiky support. So individuals and patients have to wait months sometimes for the support that they need for the intensive care that they need for hospitals or clinics or therapy, and then they for a few weeks or a few months have the support, and again after that it's completely done. So like that's a very kind of spiky support right now, and it leads to a lot of inefficiencies and burden on the healthcare system. So what we're doing with Doro is to use artificial intelligence, chatbots, and agentic workflows to reduce this burden and make it a continuous support. We make sure that during the wait lines, patients are actively analyzed to see if their symptoms are getting worse, are getting better, which patients should be prioritized, and post-support, so post-discharge and after they come out of the intensive care, they have to still have some sort of a continuous support. They shouldn't go from 24/7 hour support to nothing. So post-discharge, we have to make sure they're taking their medications, compliance of medication, and make sure their symptoms are getting better or worse.